Okay, this video is for Anatomy Physiology, Chapter 1, Blood, Vessel, and Hemodynamics. So the blood vessels are another major component of the circulatory system. You have the blood, the heart, and the blood vessels. They're dynamic, interactive, essential components of the system. There are a few different types of blood vessels that you need to know. After the blood leaves the heart, the vessels taking the blood away from the heart are called arteries. There's different types of arteries. The largest ones are referred to as elastic arteries. Um, they can stretch and bounce back easier. Then you have medium muscular arteries, and then the smallest type of arteries are arterioles. After the blood essentially goes through those types of arteries, so elastic, muscular, then the arterioles, the blood will then enter the smallest blood vessels in your body, is known as the capillaries. This is where nutrient and gas exchange happens in the tissues. After that exchange has happened, blood is then routed back to the heart via veins, okay? But before the blood gets to the larger veins, they go through smaller venules into larger veins. Blood vessels differ in their, not the types of layers, but like the thickness of them, or presence of absence of different layers. They share three tunics. The layer on the inside of the blood vessels is tunica interna. That's that endothelial lining on the inside. The tunica media is the muscular layer, and then the outside layer of the blood vessel is the tunica externa. So the largest arteries are called elastic arteries, like the aorta is a great example. Very large. The walls are thin compared to their overall size, but they are designed for carrying a lot of blood under high pressure, so they can stretch easily and go back to their original size easily after the blood has left them. When they stretch like that, they actually hold mechanical energy after the ventricles have contracted, that ventricular systole, and they hold that energy. Then after the valves close, the aortic and the pulmonary valves close, they transmit that energy through our systemic circulation. This is just an image showing that. So here the ventricles are contracting. This is the aorta pushing that blood up into the aorta. That arrows represent the energy kind of goes into the walls of that aorta. And after the valves close here, the energy is still, then it's transmitted outward to keep that blood flowing. So here is, okay, we have artery, pass the blood to the arteriole. Here you can see an arteriole. They actually deliver the blood to the capillaries, and they have a great influence on blood flow and overall blood pressure, because look at this. See these little precapillary sphincters? They're like little, as your book calls, adjustable nozzles. So they can close or open depending on the physiological needs of the tissues of your body. Okay, they control essentially, for that reason, blood flow and overall blood pressure, because they have these little nozzles or precapillary sphincters, and essentially they can open the blood flow or restrict it. So blood is now in the capillaries, and this is where gases, water, other nutrients are exchanged. Also notice here is an arteriole. You can see the intermittent muscle. It doesn't cover the entire thing. And look at the capillaries. Absolutely no muscle layer in the capillaries. Okay, just that endothelial lining, which makes it easier for gases and nutrients to be exchanged. After the blood leaves the capillaries, you can also see it turning color here. It loses that oxygen, and these are venules that then will carry that deoxygenated blood back to the arteries. A little bit more about capillaries. Like I said, they differ in structure from other blood vessels. They only have the endothelial lining, underline that, endothelial lining. There's no other layers. They don't have a muscular layer, so they can't really contract themselves. Because they're minimalist in their structure, they're very permissible to the diffusion of substances in and out, fluids, gases, other small molecules. Three types of capillaries. Continuous capillaries are the most common. Their endothelial cells, or that lining, continuously tube, hardly any holes in it essentially. Fenestrated capillaries, and fenestra is like windows, has little holes essentially in the capillaries. You can find these in the kidneys where the blood is filtered, the intestines where nutrients are filtered, endocrine glands, pretty much parts of the body that are more porous. Um, and the sinusoids are even larger holes. So capillaries with extremely large holes in comparison. Blood essentially percolates like a coffee, how it percolates um, through the filter. Okay, yeah. So you're going to find these in the liver and the spleen. Large amount of blood in both of those organs. And this is just an image um, of those three types of capillaries. Continuous, no really holes in it. Fenestrated, we see little holes like in the kidneys. And then here's the sinusoid, large holes. All right. So after the blood leaves the capillaries, it's lower in oxygen and it goes into the venule system. Venules into veins. Veins have thinner walls. They don't have as much muscle or elastic tissue compared to arteries because they operate at much lower pressures. Comparing the intravenous pressure compared to that of an arterial, it's about half. And even in some larger veins, only 1 to 2 millimeters of mercury. Because the veins are so low in pressure, they have valves within them in the center that helps keep the blood flowing in one direction up back towards the heart. If somebody has higher pressure, higher than normal blood pressures, somebody with hypertension for excessive period of time, one of the things that can happen is the veins can become incompetent. This is called varicose veins, and here's a picture of it. This person, essentially their valves aren't working properly. The valves are supposed to close off that blood flow so blood can't pool and go backwards. Well, in varicose veins, that's exactly what happens, and the blood kind of pools in the legs. Hypertension can cause this. Old age has something to do with it too. It's a complication of pregnancy sometimes. Sometimes it is even common in certain families. And there are surgeries, varicose vein surgery, laser treatments that can be used to take, because it is painful as well as doesn't look very cool, but also causes some pain. All right, so fluid exchange. So in the capillaries, the fluid, the gases need to be exchanged. Let's talk specifically about fluid. The movement of fluid in and out of the capillaries is due to forces, hydrostatic forces and osmotic forces. Determines how much blood leaves the capillaries and how much blood re-enters or is reabsorbed into the capillaries. These are called the Starling forces. The movement of, so if this is our blood vessel, the movement of fluids moving from the blood vessels to the tissues, so out into the tissues, is called filtration. Like, water through a coffee filter, filtration. And the opposite movement of that fluid going back into the blood vessels is called reabsorption, back into the capillaries. And this is a great image. Make sure you take a look at this in your book. You read through the entire figure description and you kind of understand what's going on. I'll briefly show it to you in this video. So here's the arterial end, and here's the venule end, and here's the capillary, right? So blood's coming in from the arterioles, and this is represents the blood hydrostatic pressure, and this represents the blood colloid osmotic pressure, and this represents the interstitial fluid. The big thing that I want you to get here is the pressure pushed outward is greater than the pressure pushed inward. You can see here, this is the math. The net filtration pressure is going to be positive. So fluid is going to move out into the tissues around that blood vessel, okay? If we go down further, those numbers change further down the capillary. Now, instead of having a net pressure outwards, you have a net pressure inwards, okay? And this is when our fluid goes back into the blood vessel, the capillaries, is called net reabsorption. And you'll also see in this image, besides the blood vessel, we have a lymphatic capillary. Most of the fluid that goes out eventually is reabsorbed into the blood. About 85% of the fluid is reabsorbed. What happens to that other 15%? You cannot have fluid accumulate in the tissues of your bodies. It could cause what's known as edema or swelling in that tissue, which maybe some of you have experienced. When you sprain a joint or break a bone, you have edema, the swelling. But the lymphatic system exists to prevent that. So back in this image, that other 15% that is not reabsorbed, the lymphatic system should pick up to reroute to the circulatory system. It dumps its contents actually back into the right atrium as well. And that's what this is saying. Fluid that is not reabsorbed, about 3 liters per day, enters lymphatic vessels to eventually return back to the blood. Okay, so that was fluid exchange. And the reason why fluid goes in and out of the capillaries is due to pressure differences. Higher pressure outwards, fluid's going to move out of the capillaries. Higher pressure inwards, fluid's going to move into the capillaries. This is about gases and other small particles. What's the reason? Why do they move from one side to the other? Why do they move from the capillaries into the cells and from the cells into a capillaries? We've talked about this before, chapter 3. It has to do with that concentration gradient. So if there's a higher amount of oxygen inside of the blood, you compare it to the outside, oxygen will move from the blood vessels into the tissues, from a high to low, or down the ladder. It's simple diffusion. This is another good image here showing that. Here's the systemic capillaries, dissolved oxygen. Oxygen is going to go from the blood to the tissues. And then after that, the tissues build up a waste, and then it goes back into the blood, high to low. Passive diffusion. Veins. So they're under low pressure, they have these valves. Veins are also important to the body because they are a blood reservoir. A reservoir is a containment device, essentially. So blood, look at this pie chart here. 64% of the blood in your body resides in your systemic veins and venules. That's a lot. So at rest, 64% of your blood is hanging out in your veins. That's why when we draw blood, we get it from your veins. Cool thing is if blood is needed quickly, blood can be diverted quickly to the heart via the veins. So for example, if you have a drop in blood pressure quickly, your nervous system can stimulate your veins to venoconstrict. So the veins will tighten and it will push the blood up towards your heart at a greater volume. 3 things that help and the return of blood to the heart. Number 1, the valves within the veins help preventing backflow. 2, skeletal muscle pump and action of breathing. Because the same amount of blood leaving the heart needs to be entering the heart. So valves I've already talked about help prevent the backflow. Skeletal muscle pump, you can see the image here, for example, the gastrocnemius muscle, the veins in between the muscles of your legs here. As you contract those muscles, they will milk the blood, essentially squeeze the blood up like a Go-Gurt, up towards the heart. And the valves help prevent the backflow. The respiratory pump is simply your respiratory system, your diaphragm, that muscle that separates your thorax from your abdomen. As you inhale, it creates a negative pressure within the thoracic and the abdominal cavity, and it pulls the blood in your veins towards the heart due to that negative pressure. And this is just a closer image of the skeletal muscle pump. All right, so venous return. Although this is kind of what we talked about in chapter 22. Um,